Hello, I am Dr. Anusha Matam, consultant rheumatologist at Bangalore. Have you ever heard of rheumatoid arthritis? It is a chronic inflammatory arthritis predominantly affecting small joints of hands and feet. We see this rheumatoid arthritis mostly in females around 20 to 40 years of age. And what are the symptoms of rheumatoid arthritis? Predominantly affects the small joints of hands and feet. You can find joint pain along with swelling, especially in the mornings and after brief periods of rest, which eases after a brief period of activity or exercise. If you have joint pains more than 6 weeks, which is not settling with basic medications, then you should think of rheumatoid arthritis. Along with joint pains and swelling, you can have other symptoms like loss of weight, loss of appetite, dry mouth, dry eye, and extreme fatigue. So if you have these symptoms, you should always consider diagnosis of rheumatoid arthritis, as it is the most common arthritis we see in our daily practice. How do you diagnose rheumatoid arthritis? Rheumatoid arthritis occupies the top list when it is seen in a young female with all these symptoms. With few basic blood tests like rheumatoid factor and anti-CCP, which is anti-citrullinated peptide. With this test, we can diagnose rheumatoid arthritis if it is associated with signs and symptoms as mentioned above. And what is rheumatoid factor? Rheumatoid factor is a protein which is found in all of us. It is found in high values in patients who are diagnosed with rheumatoid arthritis. And rheumatoid factor is not exclusive to rheumatoid arthritis. It can be found in many other conditions like cancers, infections, tuberculosis, and other autoimmune conditions. So how do you treat rheumatoid arthritis? Rheumatoid arthritis, there are so many treatment options available for rheumatoid arthritis nowadays. We start with basic DMARDs, disease modifying anti-rheumatic agents like methotrexate, leflunomide, sulfasalazine, along with low dose of steroids for brief periods of time. If you are getting better with these medications, we can continue these medications. We will be monitoring you every 2 to 3 months to see the response. And if there is no response, there are other classes of drugs like basic DMARDs, disease modifying agents, and biologicals. Biologicals include JAK inhibitors and TNF inhibitors. If it is not responsive to these medications, there is rituximab, which is anti-B cell targeting therapy. And other than medications, there is always a scope for exercise and lifestyle changes in rheumatoid arthritis. You should be physically active, avoid sedentary lifestyles, avoid inflammatory diet, engage in yoga, walking, swimming, cycling, and other exercises to keep you fit and healthy.